Well, as a chiropractic physician for many years, I've literally treated every variety of chronic and acute low back pain that has presented in my office, and I've always looked for specialized protocols by which to treat people like this who have come into the office seeking relief from pain. Back pain has become the #1 reason why physicians prescribe addictive opioid medication. It's also the leading reason for disability and probably the costliest reason for disability, and also the major reason why many people in the general public lose the ability to conduct daily activities on a regular basis. The frequency of low back pain is that probably about 80 million people a year in this country alone will at some time suffer low back pain in their lifetime, which means that inevitably each and every one of us at some point in our lives will probably experience low back pain. This is something that has become epidemic in this country. And I think that people are looking for some type of relief from this in a substantial way so that they don't experience the restrictions that generally come along with an acute incidence of back pain. Man is a biped, and unlike most other creatures in nature, through our evolution, we have adapted to walking in an upright position. And this, unfortunately, puts a significant degree of weight-bearing stress on the critical central structure of the spine, so that when you experience these types of pressures on a daily basis, we see that it puts pressure on one of the key structures in the spine, the disc, which is that gelatinous structure or cushion, if you will, in between the vertebrae in your spine that acts as a kind of mini shock absorber to cushion the spine and make possible all of the flexibility and movements that we as humans are capable of. At some point in our lives, usually about in our mid-30s or so, the normal circulatory channels which feed the disc and keep it nourished and keep it healthy fade away. And this is just nature's dirty little trick on us as humans. And unfortunately, this occurs at a time in our lives when we're probably subjected to the most stressful activity by way of lifting, bending, and prolonged sitting on a repeated basis. And unfortunately, as that happens, the disc compresses. It begins to flatten out, pushing out all of the nutrients and blood in the disc, causing it to become deformed and degenerated. And this is a progressive and relentless process that occurs over a lifetime that is accelerated by injuries and by repeated strenuous and stressful activity. So what happens eventually is that the disc, which was once of a very supple gelatinous nature, turns into the consistency of dried toothpaste. When I was actively treating patients, I was looking for an efficient way to treat a lot of these very serious disc problems. And one of the protocols that I used involved subjecting patients to a combined dynamic movement of flexion and distraction by means of a specialized table, which was specially made for that purpose. In the act of accomplishing this protocol, what patients would experience would be a separation of the vertebrae with the disc in between. And what that does is it allows pressure to be relieved from the disc, as well as the related structures to the disc and the spine. But most importantly, it allows for the transmission of blood and nutrients across the end plate of the vertebrae into the disc to nourish the disc, to allow the disc to reinvigorate itself and to be restored to its former state of health. And it also helps to accelerate healing. When we designed LIFT, we were able to provide patients with a tool that they could basically use in the convenience of their own home, which essentially duplicated this dynamic motion of flexion and distraction, which is critical to the health of the disc, to bring more nutrients into the disc and accelerate healing and restore the disc to its normal, vigorous state. So with the lift, patients now have a tool by which, say, a chronically suffering individual is able to support and control his pain, and an acutely injured patient is able to reduce his pain on a daily basis in the comfort of his own home to ensure that he's going to have proper recovery. And in the act of doing that, they're able to avoid addictive narcotic medication, reduce their doctor's visits, and most importantly, avoid unnecessary surgery, which in reality is probably only effective maybe less than 5% of the time. So now with LIFT, patients will have a resource that they can use to restore their ability to be able to move comfortably and get back to doing the things that they enjoy doing most in their life. The lift is of course very, very beneficial for the older demographic of people who have gone through a lifetime of abuse of their lower back and experience the acute or severely chronic situation. For those people, it's going to be immensely beneficial. But it's also very helpful for the younger patient who wants to avoid these situations. And by using the lift on a regular basis, even without being in pain, they're able to maintain the health and the integrity of the disc in order to avoid those problems in the future. The flexion is basically bending forward. And because when you bend forward, the center of the disc, or what we call the nucleus, actually moves in that direction. And that's the reason why that's important, is because as the disc moves away from that center toward the front of the compartment of the disc, it's moving away from the posterior region where the nerve roots from the spinal cord come out. And that's where a lot of people run into problems with a bulging disc, because the disc will bulge out into the area of the neural canal. And the reason why that happens is because that's the thinnest portion of the disc, and that's where it's weakest. So with injury, that's where it's most likely to bulge. And unfortunately, that happens to be where the nerve root is, and that's how people acquire sciatic pain. So by flexing the spine, you're actually creating an environment where you're alleviating some of that pressure. And this has been studied in many research projects where they've been able to verify that that really is the best movement in most situations, where it relieves pressure from the disc, relieves pressure from the posterior elements in the spine, and most importantly, relieves pressure from the affected nerve root. Now, traction does essentially the same thing, only in one plane. By separating the vertebrae, you're able to reduce the pressure in the disc, and you're able to get pressure off of the nerve. However, by combining those two movements, you're really killing two birds with one stone. You're getting all the pressure off of the posterior elements of the spine, and you're reducing the pressure in the disc, and you're able to get that oxygenated blood and those nutrients back into the disc to accelerate the healing process, and that's really important after injury. Well, the benefits of lift are simply that it allows the patient to reproduce this very dynamic combined action of flexion coupled with traction. And this is based on the protocols that work so successfully in the office, using the specialized table to produce that same effect in patients on a repeated basis. In providing a device that allows patients to do this on their own, now they have control over that situation. And even after they're finished their clinical treatments, they have a way that they can support this and continue this therapy on their own at home to keep themselves out of trouble. And it accomplishes the long view of successful rehabilitation. Well, as a physician, I have very little engineering background. I would not even attempt to try to come up with an idea or a solution to an idea like this without engineering expertise. And although I had the concept of wanting to be able to reproduce this dynamic combination of movement based on the protocols that I had used so successfully, I really didn't know how to efficiently incorporate that into a device until I spoke to a team of engineers who, once it was explained to them, because of their athletic backgrounds and because of their experience in the engineering world, were able to grasp the concept and come up with a solution to that problem in creating a device that would most efficiently reproduce that movement. Well, the engineers came up with a very ingenious concept. It's called the center link. And the center link is what actually, when the user pulls the handle down, the center link actually moves the carriage arm forward and raises it up so that the knees are elevated. This produces the traction in the lower back, and the angle of the carriage arm actually produces the flexion in the spine. Because of the center link's construction and its position in the carriage arm, it makes it very, very ergonomically easy. It requires very, very little effort for the user or the patient to be able to pull the handle down and even keep the handle down in order to sustain a level of traction in between intermittent pulls of the handle. So the hips immediately begin to rise, and as they rise, the hips go into flexion mode. This in turn flexes all of the segments in the lumbar spine. And at the same time that's happening, the vertebrae are being opened up. The vertebrae are being stretched apart. That's where the combined flexion and traction occurs. This is what reduces all of the pressure within the disc, and the opening and closing is what forces more blood supply and nutrients into the critical structures of the disc, the outer wall and the inner gelatinous nucleus. I mean, principally, it's being able to solve problems for people. And again, we go back to the statistic that back pain is probably about the second or third most common complaint that comes into a doctor's office. And most doctors, if they work according to their protocols, will basically initially give the patient maybe some non-steroidal anti-inflammatories to alleviate the pain, advise some bed rest, and they'll let the patient go for about 6 weeks. And after that 6-week period, if there's no change, then they may refer them to a physical therapist. And the physical therapist may do some modalities like ultrasound or hot packs or electrical stimulation. And if there's still no change after several weeks, then the patient gets referred for a surgical consult. What I enjoyed most about seeing patients like this is listening to their problem, seeing how it interfered with their lifestyle, and then coming up with a solution to actually fix the problem and to do it in a conservative fashion, without drugs, without surgery. And that's very satisfying.